health insurance exchanges in New Hampshire. Coming up in the Cloakroom. The debate over Obamacare is heated in the New Hampshire State House, as the House and Senate are debating how to implement the 2-year-old health care law imposed by the federal government. One of the more controversial aspects of that law are health insurance exchanges. The law envisions setting them up at the state level to implement the health insurance mandates, the premium supports, and other provisions in the Patient Protection and Affordable Care Act, known as Obamacare. But opponents of that law say state healthcare exchanges would merely provide a state agency to impose federal mandates at the cost of state taxpayers. The House Commerce Committee is debating a bill by Representative Andrew Banoose that would prevent the state from setting up its own exchange.
We're going to be under federal control either way. The only pleasure that we get with the state health insurance exchange is the pleasure to pay for it with $10 million to $47 million a year. So that's the only real difference between the federal health insurance exchange and the state health insurance exchange. And that's why we're still prohibiting the creation of one in this bill.
Banoose invited Michael Cannon from the Cato Institute, a national expert on healthcare policy, to brief the committee on the pros and cons of New Hampshire setting up its own health insurance exchange.
There is no mandate for, even though the law envisions that states will create these exchanges, there is no mandate that states create them. States have the option of creating exchanges. They will not lose Medicaid funding if they fail to create a health insurance exchange. And so, I think the issue that states are struggling with, and I think that you're struggling with, is given that the future of this healthcare law is in doubt. The Supreme Court is going to be hearing oral arguments on a couple of dimensions of the law and their constitutionality in March. They're probably going to be ruling by the end of June. At least that's what my lawyer friends at the Cato Institute tell me is going to happen. Against that backdrop, should New Hampshire create a health insurance exchange? And I think the answer is no. The reason is that, for lots of reasons actually, I think for those who oppose the law because it's unconstitutional, I think it's a very simple question. If you believe that the federal law is unconstitutional, then as elected officials in the state of New Hampshire, you've taken an oath to protect the U.S. Constitution as well as the New Hampshire Constitution. That means using all lawful means to block laws that you believe violate the Constitution. But whether you support or exchange the law, there are a number of reasons why I think you should not be creating a health insurance exchange. New Hampshire, I think state officials don't have the time, they don't have the money. This could cost $10 million or more to operate per year, and the state of New Hampshire will be on the hook for those operating costs starting in the year of 2015. It makes little sense to create a new government bureaucracy to implement a law that could be repealed or overturned tomorrow. Creating a health insurance exchange would actually put New Hampshire officials in a place where they're in a position where they're the ones taking the blame when the health care law begins hurting some of the sickest patients in New Hampshire and around the country. And I can say more about that if you're interested. And finally, I think that creating an exchange will expose New Hampshire employers to penalties that they would not face if New Hampshire refuses to create a health insurance exchange.
New Hampshire insurers favor a state exchange, arguing that they'll be able to influence how the state implements the federal regulations, but they won't be able to if the federal government runs the exchange on its own. Paula Rogers spoke on behalf of Anthem Blue Cross.
What I'm having a hard time understanding is why moving forward with something like Senate Bill 163 and moving away from an out-and-out prohibition of moving in the direction of creating a minimalist exchange is such a problem. Because as Mr. Cannon said, we do have time, but if we have a prohibition, we don't have any opportunity. And my feeling is to wipe away an opportunity is really short-sighted. And I really feel strongly about this, even beyond the fact that I represent an insurer. I think many of us have a very large measure of uncertainty about what this marketplace is going to be in 2 years, in 3 years. But the reality is we've already lived with large changes because of ACA, and I think a lot of consumers agree with many of those changes, and they're enjoying the benefits of that. And yes, there is a cost to this, and yes, we have a challenge, But I really do believe that we need to do some major reform in this country to address the very things that Mr. Cannon is talking about, the uninsured and costs. And just walking away from the exchange and saying that is one area we are never going to look at just seems to me entirely short-sighted.
While the House Commerce Committee deliberates Manusa's bill banning a health insurance exchange, a proposal by Senator Ray White sits on the table in the New Hampshire Senate that would set one up in New Hampshire. The debate will continue in both chambers, and you can track it right here in the cloakroom. I'm Grant Bossy. Thanks for watching.